what might you like practitioners who are going through something similar or who just might want to prevent ever having to go there? What might you like them to know that would be, of service to them, that would be helpful to them? What would you like them to take away from this call?
Well, what I'd like them to know, first of all, is that although some people say burnout in medicine is inevitable, I don't believe that with the proper training and habits that it is inevitable. I think physicians need to know the risk of burnout, the factors that cause burnout, and basically how to prevent that on an ongoing basis. In other words, I'd like people to know how to live a stress and burnout resistant lifestyle. It's not just one thing, it's a whole lifestyle they need to adopt for themselves to prevent this from happening.
Could you give an example of one trick that you have or one step?
Yes, well, there's so many parts to reducing stress at work and preventing burnout. One of the first steps really is to just take care of immediate stress. Things happen during the day that are stressful. That's normal, and it's not necessarily bad, but you need a way to release that stress and to move on to the next task without that hanging on. And the best way that I've discovered, and has been shown in the research to be true as well, is developing a mindfulness practice, which is a very simple way of letting go of emotions, past experiences, and internal dialogues in the head, and just coming back to the present moment and being there with yourself, with your patient, in the present moment. And it helps reduce stress, it improves anxiety, and it actually improves communication and medical care as well.
That's awesome. And that makes total sense. And so tell us some more.
All right, so mindfulness is not something new. It's been known for thousands of years, and it's been present in many spiritual traditions. Most prominent probably in the Buddhist tradition. But about 40 years ago, Dr. John Kabat-Zinn at the University of Massachusetts developed a program that he called mindfulness-based stress reduction, and it consisted essentially of meditation exercises that were non-religious. They focused on the breath, as well as some, yoga-like body movement exercises. And he trained patients who were undergoing illness, especially chronic illness, in these techniques, and found that they were not only happier, but they recovered faster and better as well. And so he started teaching this technique not only to patients, but to other practitioners in order that they could spread this technique around. And I was fortunate enough to attend 3 of his teaching retreats so I could learn his technique. In addition, I've had my own personal mindfulness practice in the Zen Buddhist tradition for the last 25 years or so. And when I teach mindfulness, I sort of use a combination of all the different things I've learned to make it simple and, again, acceptable to any spiritual tradition, but to make it accessible enough and easy enough that even a busy physician can find time to do it during the day.
That's fabulous. And that makes such good sense. Could you just say a little bit about mindfulness? What if, you're a real novice and people don't know what mindfulness means? I mean, I think we assume at this point that that word has become part of the vocabulary, but there are people who don't know that.
Sure. I mean, in short, really, mindfulness is really, it's just developing moment-to-moment, non-judgmental awareness. I know that's a mouthful, but in a practical sense, what we do basically is we sit in a comfortable posture and just notice the physical sensation of our body breathing. And we bring our attention to our breathing. We don't try to control it. We don't try to change it. We just notice it in a non-judgmental way. Each breath is different, but each breath has an equal value. It doesn't really matter whether it's a deep or a shallow breath, a long breath, or a slow breath. We just notice it. And what happens is, after a few seconds, we find that our mind has wandered off the breath and has gone to some train of thought that we're caught up in. And when we notice that, all we do is simply say, okay, let's just bring our attention back gently to the breath. And by doing that, we essentially develop our ability to focus on what's happening in the present moment and not get caught up in thoughts and emotions from the past.
And it's a really interesting practice. I've got one of those, monkey brains
Mm-hmm.
that's very well developed. It really monkeys around a lot. Um, so it's hard for me to do that.
It's actually not. Many people have monkey minds. I'm one myself. But just like any other skill, it takes practice. You have to be kind and gentle with yourself, and you have to be consistent about practicing. When you go to the gym to get yourself in shape, you don't just go once and say, "Okay, I'm in shape." You have to practice, and you have to work your way up to a certain level of fitness. And the same is true of spiritual fitness and mental fitness. You have to work your way up to it gradually and gently. You don't want to sprain your brain.